the spirit of Louisiana. This is Louisiana's news leader, Channel 4's Eyewitness News.
Louisiana doctors are one step closer tonight to finding out if heart attack patients can use their own bodies to heal themselves.
Medical reporter Meg Farris has this exclusive look at one of the first people in the United States to check if it works.
Bill Edgett is happy he can walk. At only 64, he's happy to be alive.
I couldn't ring a bell to get a nurse. If my wife stayed with me for 3 months, she didn't leave my side for 3 months. If your nose itched, you better ask somebody to scratch it for you because you couldn't do that.
Bill has had his share of heart attacks and procedures to fix the damage. Balloons to open blocked arteries, stents to keep them open, open heart surgery with a triple bypass. Then, last year, what he thought was the flu was an infection that put him in a long coma and nearly took his life.
It was double pneumonia, and I went right into liver failure, and then I went into kidney failure. And then a week and a half after I was in intensive care, I ruptured a bowel. I had a trach in my throat. I had a feeding tube. I had a colostomy bag, an ileostomy bag.
Mr. Edgett. Now there's more blockage, but Bill's lungs are not strong enough to go through more surgery. So interventional cardiologist Dr. Gabriel LaSala is trying something new on Bill here at Lakeview Regional Medical Center in Covington. He's the first Louisiana heart patient in a study to see if a concentration of his own stem cells can create and build new blood vessels to his heart.
We have done this in patients who have problems with their legs, that they have very poor circulation. And we have injected stem cells on them, and we have found a significant increase in the circulation of the leg.
Now Dr. LaSala is one of only 3 doctors in the country who is trying it in the heart. Here's how it works. Cell biologist Dr. Jose Miguel took some bone marrow out of Bill's hip bone. Then he isolated about 1,500 of a certain type of stem cell and grew them in 19 days to 15 million in a special closed lab. These stem cells have the ability to become the type of tissue that's needed to repair the body. The cells can be stored in extremely cold vats until the patient's ready. Then, a catheter is threaded up Bill's leg vessels to his heart, and his own stem cells are squirted out of the catheter in the exact area where there is blockage. In 6 weeks, they hope new arteries will grow on their own and go around or bypass the blockages, giving Bill's heart a new avenue for oxygen-rich blood.
I see the day when we are going to see medicine facing a new era. A patient have the opportunity or the source, to get a lot of cells to repair what is wrong due to age, due to disease, or an accident, or anything.
The potential of this is tremendous because there are 20 million Americans with severe coronary artery disease who have no other treatment. They have no options. So the potential is huge.
I'm so thankful that I was in the right spot in the right time to be able to have a chance to have this procedure done, and because I don't think there was very many options left to me, and I mean to be the first it's a great thrill. It really is.
Meg Farris, Eyewitness News, Medical Watch.
If you have heart disease but cannot have any of the current procedures or surgery, you may be able to qualify for this stem cell study. Just call 985-867-4860 for more information.